All right, so today we're going to talk about the connection breath, where we try to incorporate our upper core with our lower core or our pelvic floor. But before we do that, I think a lot of people don't really understand or know much about the pelvic floor. So I wanted to kind of give a few examples and talk about that so we can understand what we're talking about in the first place. So the pelvic floor muscles connect to the bottom of the pelvic girdle. They're the muscles that we use when we feel like we have to go to the bathroom and we're trying to hold that in or trying not to pass gas. Those are the muscles that are contracted. And then, in order to allow ourselves to go or pass gas, you have to relax those pelvic floor muscles. So, that's kind of the best way that people can understand what they are. And they're really important for everybody, but for pregnant people, because as we exercise, being able to control the pressure in the pelvic floor and engaging these muscles at the right time can help us to be able to exercise more safely. And then also, for giving birth, they're very important. And to be able to recover postpartum, having this connection for them is going to make things a lot easier after that. So, the pelvic floor muscles, like I said, are the bottom of the pelvic girdle. And then we have our diaphragm right here. And this diaphragm helps us to be able to breathe. So as we breathe in with the diaphragmatic breath, so when we're breathing properly, where we're seeing our stomach expand, um, our diaphragm is contracting and lowering. And as that diaphragm lowers, the pelvic floor also lowers, and that relaxes. So as our diaphragm lowers, as we breathe in, then our pelvic floor lowers. Now, as we exhale, we'll notice that the belly will flatten and the core muscles will engage. Then the diaphragm will raise up as it relaxes, and then the pelvic floor will raise up as it contracts. So, what we want to do with the connection breath is be able to tie all of these things in together because it isn't something that, like I said, I think a lot of people have connection to. So in order to set this up, I like to do this sitting on a chair. There's lots of other ways, and I will talk more about other variations we can do. But sitting on a chair, I want to sit on our sits bones. So you should feel like those bones at the bottom of your butt. And sometimes like spreading the glute muscles can help to be able to feel those. And then from here, I want a nice neutral spine. So I don't want to overarch my back or round it because if I have that pelvis out of more optimal alignment, I'm not going to be able to use that diaphragm properly. So on the sits bones, we've got that spine nice and neutral. And then from here, I've got my rib cage stacked over my pelvis. So next, I'm going to put one hand on the stomach, one hand on the rib cage. And as I inhale, I want to see my hands move away from my body. So I want you to practice this as well with the inhale. And first, we'll just practicing diaphragmatic breathing with inhaling and getting our hands to move away from our body. Then we can add in pelvic floor aspects. So from here, I'll show you what a few of these look like. As I inhale, my stomach expands and my rib cage expands, and you saw that my hands moved away from my body. And then as I exhale, core is engaging, and you'll notice that my belly's flattening and my hands move closer. So here we go. So first we want to practice that. Once we get that down, the inhaling and the diaphragmatic breathing where we have the stomach expand, the next thing we want to do is add in the pelvic floor portion. So remember, as we inhale, the pelvic floor relaxes or drops. I like to sometimes think of the pelvic floor like an elevator. So as we're inhaling, it's lowering down, and as we exhale, it's raising to the top floor. So if that helps you to envision what's going on, that's awesome. So here we go. We're going to inhale, and I'm going to try to relax my pelvic floor muscles, allow them to lower. So you go ahead, take however many of those you need to start feeling that. And then once we get that inhale and the ability to relax the pelvic floor muscles, which is equally as important as being able to engage them. I think oftentimes we only talk about Kegels and how to strengthen or contract the pelvic floor, but a lot of women also have a very hard time relaxing it. So this is equally important. So we want to make sure that we can do that. And once we can do that, we will add an exhale. So exhale, like I said, our belly is going to flatten, our core will engage, and our pelvic floor will raise up. So we want to actively engage the pelvic floor and have that raise up, that elevator raise up. So here we go. I'm going to add in both parts here. Now, often breathing out with those pursed lips, like you've got a straw in your mouth, can help you to get that proper exhale that engages those muscles as well. So, from here, that's how we could do it seated. There are other ways that we can do this, and it is valuable to practice different ones. So, sometimes seated is really hard for people to connect to those muscles. So, another option is lying down on our back. Now, if you are in the second or third trimester of your pregnancy, this might be a contraindicated position or a position that wouldn't be good for you. It is rare, but there are women that as they lie on their back, the belly, the weight of the baby will end up compressing one of the main veins that sends blood back to the heart and obviously limits blood flow. So we don't want that. So if you have any symptoms when you're lying on your back with this or any exercises, you want to stop. So lightheadedness, nausea, any general discomfort, and struggling breathing, any of that stuff would be a sign that we don't want to lie on our back. But if we are comfortable there and we don't have issues, we want to go ahead, lie on our back with a neutral spine. So I've got a slight arch in my low back. And then I've got my knees up here. So as I do that, we can do the same thing we just did seated. So as I inhale, my stomach will expand. I will lower the pelvic floor. And then as I exhale, I'm going to flatten. My stomach will flatten as I let that air out. Pelvic floor, I want to engage and try to raise up. So here we go. A lot of women do find that this is an easier position to learn that connection breath in. Like I said, just make sure it's appropriate for you and listen to your body. So other ways that we can practice this, like I said, there's value to all of these. So mixing it up is good. Maybe take whatever position is easiest for you, which might be lying down or seated in a chair. And then from there, we can progress to other ways like kneeling or tall kneeling. We can do standing. And then also a more functional way that we can tie this in and get our pelvic floor working with the rest of our body is an exercise. So with strength training, you'll want to engage the pelvic floor on exertion. So we can practice the same idea with connection breath during exercises. So for example, if we're doing a seated row and the exertion is I row the weight towards my stomach here, and as I do that, I would be exhaling and then engaging that pelvic floor. And then as I let the weight return, I'm going to inhale, stomach expands, pelvic floor lowers. So you can work that in with your exercise routine as well. And then in squats, that would be lowering portion is going to be the inhale, relax. And then as we raise up, pelvic floor engage. And then from here, the core is engaged and that belly flattens. So those are all really good ideas to try to advance this move and to use it in more functional ways.